Welcome, everybody, to another edition of Insights into Addiction and Mental Health. This show is brought to you by Neuro Psychiatric Addiction Clinic. And, of course, I'm your host, Scott Jones from Addiction Training Center, and we've got Bob from Neuro Psychiatric. You're the CEO.
That's what they tell me.
Buck stops with you.
Well, I hope so.
And in other shows, we've talked a lot about your neuropsychiatric addiction clinic, and we offer certainly, if you have any questions about this show or about anything we talk about, reach out to us. You can go to npaddictionclinic.com and find our contact information. And certainly, Bob will continue any conversation if you need to get a hold of me. I'm at Addiction Training Center. But anyway, Bob, one of the things we mentioned in a previous show was pregnancy, and I know that's a big thing. There's some places, and they probably shouldn't, that do not accept women who are pregnant. Yeah. You do, though. Yeah. I mean, are there limitations on that, or how does that work?
Well, a lot of times treatment facilities shy away from that because, women who are pregnant are at high risk when they're addicted to alcohol or drugs. It's what they consider a high risk pregnancy. And, a lot of treatment facilities are uncomfortable. Their medical directors not be comfortable. I am blessed that my medical director is extremely comfortable with it, and so are my staff. And, but there's some limitations. There's at least only one medication that I'm aware of called Subutex, and that's a medication that's approved by the FDA to be used with pregnant women. And we will detox women using Subutex. And Dr. Toledo, our medical director, will keep on a very small dosage of Subutex throughout their entire stay at our facility. So when they do give birth, there's going to be less chance that the baby or the mom will come out, still under the influence of drugs. And then while they're here, we have a specialized program that includes nutritional groups and nursing groups. If they have an OBGYN doctor, we make sure they're going to their OBGYN appointments. If they're not, we're going to hook them up with somebody. And we'll do that through the second trimester. Now, we'll be able to treat people pregnant with the second trimester, and maybe into the beginning of the third trimester, depending upon how their medical condition is.
Right.
We don't want to do something that's going to put the baby or the woman in jeopardy in any way.
Obviously, now a lot of people who are walking in, and you mentioned that, but I want to really touch on that. There's a lot of people, if they are in the midst of their addiction, have not had proper prenatal care. They have not been to the OBGYN. It might be well past the time when they should have, but you make sure that they're going to get that care.
Oh, absolutely. Yeah, it's very sad. I mean, a lot of times what we've seen since we've been open, we've seen a lot of women that come in that have never even had one OBGYN appointment. And that's unfortunate because, the alcohol and drugs certainly impacts, the birth of that child and the development of that child. So that's one of the first things immediately. If they don't have an OBGYN doc, we make sure they get one right away, because they need to do that.
Now, if there is, God forbid, but there could be complications or something might happen, whenever you're dealing with a pregnant person, it's almost like you're treating two in a certain sense. Sure. The baby may have different ideas about what it wants to do, and you may have a medical emergency. Do you have relationships with local hospitals and things? And
yeah, we do.
Is this the kind of thing where you do not screw around? You take them right to the medical care?
Yeah, we have 2 or 3 hospitals within 3 to 4 miles of here.
Perfect.
And so, if they come in and all of a sudden, we're seeing that their health is compromised for one reason or another, then we'll immediately get them to an OBGYN doc or to an emergency room to make sure that they're okay.
And that obviously extends to any other circumstance. It doesn't have to be pregnancy, because
absolutely.
The truth is that people are physically compromised when they come into treatment, and since you do have a detox here,
absolutely,
you're at that point where it could go south. I mean, it could be a problem, but you're prepared to handle that.
Absolutely. And that, we have nursing staff here, RNs and LPNs, 24 hours a day, 7 days a week, and we have behavioral health specialists that are here 24 hours 7, and we have licensed therapists and licensed counselors and case managers. I mean, we have we're only a 30-bed facility, and we have a high number of staffing on purpose. We staff probably more than most programs will.
Yes.
Primarily because, that's what we believe in. We believe in, making sure that the person gets the most appropriate care by the most appropriate people.
So, and I think this bears saying that if one of your staff comes to you and says, I'm recognizing a problem, one of your medical staff, a nurse or something, I mean, it's great to have them on staff, but there are facilities where they'll be on staff and they might recognize a problem, but the administrative staff will say, No, just leave them, they're fine.
Well-
You listen to your medical people, right?
Absolutely. Yeah, absolutely. You know, I hope that doesn't happen in other treatment programs. We hope and we pray that doesn't happen. But, you know, what I can assure you here is that's not going to happen. You know, that we're going to listen to our medical staff, we're going to listen to our nursing staff. We staff every single case every single morning. And, you know, the medical staff comes and say, look, might not be the appropriate place for this person. And we'll say, okay. We'll sit down with the client, we'll sit down with their family member, and we'll say, okay, let's get them someplace that is more appropriate. You know? And sometimes, you know, it's very difficult, you know, the person that comes in here, they got to participate and they got to want treatment. They got to want to get well. They want to get sober. They want to deal with their emotional problems. You know, I just can't have them sitting on the couch all day long watching TV.
Right.
Here, that's not going to happen.
Yeah. You know, now obviously in detox, you have an understanding of sluggishness and some,
Yes.
you know, lack of motivation, but
absolutely.
they've got to start finding that. You got to help them,
Right.
and it's got to happen. So
Yeah. When they first come in, we anticipate that they're going to be. It's not, you know, detox is not a pleasant experience.
No,
By any stretch of the imagination.
no.
But we try to make it as comforting and as pain-free as possible. And, you know, for the first few days, they're probably going to stay in their room. We're not going to tell you got to come to group, you got to go to this, you got to do that. You know, they need to go through the first 72 hours, and because that's, you know, some of the more difficult times as part of the detox process. When we start seeing they're coming around, we start seeing that their symptoms are going away and that they're adjusting really well, we'll encourage them to go to group, you know, and through the detox process. But when they do, if they step down to our residential program, which is within the same building, they have to go to group and they got to participate. They got to do those things.
That's fantastic. And one of the other things, you know, so certainly if you do have a loved one or yourself who happens to be pregnant and are concerned about going to treatment, first of all, do something, because staying out on the street and continuing to use is not a good situation for anybody. But definitely check it out here at NP and ask them about their track for pregnancy.
Sure.
Now, one of the other things that we're hearing a lot about these days, and it's become more of a household word, is PTSD and trauma.
Right.
Post-traumatic stress disorder, a lot of people assume that's a military or a first responder term. Mm-hmm. Truth is, everybody can suffer from PTSD. And traumas, you've got a lot of people coming in here with trauma.
Right.
You know, are you guys ready to recognize that and deal with that? How important is that?
Well, you know, a lot of people come in and they either have a co-occurring mental health problem or they actually come in with a primary mental health problem. Many have post-traumatic stress disorder. Many have trauma in their lives, and it could be, you know, that they lost a loved one, or they lost a child, or they lost somebody who actually themselves died from alcohol or drug addiction. And so our staff are specifically trained to deal with that. They do have specific therapies that they use to help the person through that. One is Emdr, which is a nationally certified trauma-focused therapy, and we have our staff who are certified in that. And so, yes, we do. I mean, we really do see a lot of that.
Yeah, and trauma can show itself in a lot of different ways. Mm-hmm. Just even somebody who's coming in and giving up their heroin and their cocaine, that's been their main motivation for even getting up in the morning for the last 10 years. Giving that up can be a traumatic experience for them. Exactly. Everything can be traumatic, especially when you're that weak, you know.
Well, people lose it. In many instances, they've lost everything.
Yeah.
You know, they've lost their jobs, they've lost money, they've lost homes, they've lost family, they've lost children. And all of that is very traumatic. And you know, it's one thing to get them detox, but then how do you deal with the associated trauma, you know, that really is one of the contributing factors to the addiction in the first place. So you really have to address those things immediately and by people who have the experience to do that. And I believe we have a great staff to do that.
So you've got to be somewhat fluid being in your position, because you're talking about addiction and you're talking about mental health.
Right.
And since you are ACA licensed, you can treat primary mental health problems.
Absolutely.
Other facilities cannot. Make sure that if you're going to go to a facility, if you got a mental health issue, make sure that they can treat primary. Right. Because there's some that will sweep it under the rug and say, well, we're treating the addiction. We'll treat your depression on the side, or your anxiety, your bipolar on the side. You don't do that here. So you got to be fluid and ready to say, okay, we're going to switch gears because now we've found something about this person.
Well, the one thing we have to understand is we're a primary mental health residential program. We're not an acute care psychiatric hospital.
Right.
So if somebody has psychiatric symptoms and behaviors that puts them at risk to themselves or somebody else, they're suicidal, or they're so psychotic, they're so delusional they cannot function, they're aggressive or violent, those folks have to go to a psych hospital. A lot of times what happens is we'll transfer them to a psychiatric hospital, and then once they get stabilized at the psych hospital, then they come to my program for the residential piece.
Okay, excellent. You guys do so much here. I mean, how do you keep up with it all?
Oh boy, I don't know. It's been a long time. I have really good staff. There's one other program I want to mention. For years and years and years, people who are on heroin and opiates were given methadone. And methadone, was before Suboxone and things like that. If you had a heroin problem and you need to maintain, they would maintain you on methadone. Unfortunately, a lot of people, the amount of methadone increased. Where now you'll see people on 200, 300, 350 milligrams of methadone. It's a very difficult detox to get people.
It seems like that's nothing more than medically managed addiction.
Well,
I mean, it's really not changing anything, is it?
Well, it's unfortunate they become addicted to the methadone, which is unfortunate.
Yeah.
But we are comfortable in detoxing people off of very high dosages of methadone, 200, 250 milligrams. We recently had a young woman that just detoxed off of 200 milligrams, and she did incredibly well.
That's a difficult detox, too.
It's a very difficult detox. But I'm really honest about it, in that if you want to come to a treatment facility and you want to be detoxed off methadone, using methadone, then we're not the place for you, because that's not what we do. We will detox you. We will give you all kinds of medications that will help you get through the detox phase of the methadone detox, but we're not going to give you methadone. We're going to get you off the methadone, and part of that detox process is to get you off of that, so that when you leave here, you're not going to have to go back to it, hopefully.
So when you're using certain medications to help people through detox,
right,
you're doing it on a taper basis and on a basis of we're using this to lessen the effects of the detox,
sure,
but we're still going to get you detoxed.
Absolutely.
It's not we're going to keep you on something.
Sure. There's a lot of medications, a lot of prescription medications that you have to be extremely careful for when people detox. Benzodiazepine, Xanax is a perfect example of it. You can be on Xanax for a year, 2 years, and using more than the prescribed medication that the doctor gives you, and all of a sudden you're addicted to Xanax. But one of the things you got to notice is that at any point in time you can have a seizure as a result of being on Xanax. And so what we do is Dr. Toledo, medical director, has a very strict protocol when he's detoxing people off of prescribed medications. He wants to keep them safe, and he does a really good job at it. And we do, and sometimes we'll take a little bit longer to detox somebody from a Xanax, because we want to make sure that they truly are not going to have any secondary reactions to the detox.
Well, let's talk about detox a little more in depth, because let's answer some basic questions.
Sure.
First of all, does somebody have to be sober to walk through the door?
Absolutely not.
Okay, so if they come in and they are drunk or high,
happens all the time.
Okay, well, I just want to make sure.
Yeah.
Now, this does not mean, because I have been caught with people who said they won't let me come in unless I'm still drunk, so you got to let me drink on the way here.
Yeah.
No, come on. But
that's
the
bad,
condition.
That's bad mojo.
Yeah, that is bad. That is bad juju right there. All right, so you can come in that condition. Right. That's one thing.
It happens all the time,
Sure.
And when they walk through the door, of course we do a pre-assessment before they get here, and then when they get here, we do a lot of other nursing assessments, stuff like that. But one of the first things we do is we have them given a urinalysis called a point-of-care cup, which will identify for us not necessarily how much, but it will identify for us exactly what they have in their system.
Okay.
So it'll tell us, do they have Xanax, do they have cocaine, do they have heroin, do they have other opiates, do they have all kinds of other medications, all other kinds of drugs. So we know, because Dr. Toledo, the medical director, and the medical staff need to know, okay, this is what they got in the system, because they got to be able to prescribe detox medications based upon what's in their system. And then what we do is we immediately send it out for confirmation, and that will give us how much that's in their system.
Now, one of the other things is when they come through the door, I know there are some facilities, and it's not right, but the client might wait anywhere from 4 to 5, 6, 7 days before they see a doctor or before they see a therapist.
No.
And when you know this happens, Bob.
Oh, I do.
I mean, that is not the case here for sure, right?
We are accredited by the Joint Commission on the Accreditation of Healthcare Organizations. It's the most respected accrediting body in this country, and they make us live up to a certain set of standards that are really very fine-hoot and very particular.
Yeah.
And so when they come to us, they're going to see the doctor. If they come during the daytime hours, and the doctor's here, they'll see him right away as soon as he walks through the door. I can guarantee you they'll see him within 24 hours of getting there. And plus, we have besides our medical director and our psychiatrist, we have a physician's assistant, a psychiatric medical physician assistant that's also here, and we have nurse practitioners that are here on the weekends. So they don't go without ever seeing someone.
You are stocked almost like a hospital, because the detox is
Yes.
It's closer to a hospital situation than it is to a rehab situation in some ways, right?
Well,
because you are concerned about stabilizing them.
We're concerned about stabilizing them. We're also concerned about setting the foundation for the continued treatment. And that's what you have to do. When they walk through the door, you're developing a master treatment plan, and you're developing a treatment protocols that hopefully, while they're staying with us, when they leave, they're going to be at least have a solid foundation and to begin their road to recovery or begin to dealing with their personal emotional problems.
See, one of the reasons I like talking to Bob is because he doesn't blow sunshine up anybody's skirt. I mean, he just tells it like it is. So let's talk about some things like, we'll go back, somebody's from Connecticut and they want to come here. But, people ask, how the hell am I going to get this person on a plane, get them down there? How do you make that process work? What can you give them advice on?
Well, again, you have an interventionist, if they're unwilling to go to treatment, that can come and help and get them into treatment. They may have to get on the plane with them and come here. One of the things is, Florida went through some fairly difficult times a few years ago about some of the behaviors that they were exhibiting by the treatment programs, which is, not unknown. It's pretty out there. But we will. If somebody wants treatment, they're going to have to get to my treatment facility. I'm not going to fly them. I'm not going to pay for a flight. That's all illegal. We will not do that.
You'll give them the information of this is where you want to fly to. I know this is a good airline. You'll give them that, but you're not buying their tickets. You're not paying for their insurance, or you're not doing those things.
No, all that stuff's illegal. Now, we can tell them, look, you want us to research out really good flights coming out of New Haven, Connecticut.
Sure.
We can do that.
Certainly.
And here it is. Here's the flight number and everything else, but you're going to have to book the ticket and pay for the ticket. And then my people will be there. Now, if they're local people, and they don't have to fly in. Let's say they live in Fort Lauderdale. Well, I have drivers who will go pick them up in Fort Lauderdale if they don't have transportation to come to the facility.
Well, you mean I didn't have to drive here today? You would have picked me up just to do this?
Yeah, I might have charged you. No, we wouldn't do that. Yeah. But one of the things I've learned over the years is that there's a window of opportunity to get people into treatment. And when somebody says to you, "I want to go to treatment," you as a loved one or a friend or whatever, you need to get them into treatment. Because if you wait 8 hours, you wait 10 hours, I guarantee you they're probably going to change their mind. And they're either going to be out using again or just going to change their mind and won't come in. So you have that window of opportunity, and it's not big.
And if you are concerned, you do suggest get on the flight with them, come down.
Absolutely.
There's probably some hotels around here if they need to stay a night or two.
Yeah.
What is the convenient airport for this facility?
This facility... For us, it's West Palm Beach.
West Palm Beach, okay. So that's about 30 minutes from here, I think,
right?
45
minutes, yeah.
Depends on how you drive.
Right, but we'll pick them up at the airport, too.
Sure, of course.
We'll pick them up at the airport because we have a big van and stuff.
Yeah. But if you're concerned about that, and you're not sure how to arrange transportation and do all that, call them. They'll help you. They're not going to do it for you, and they can't.
Right.
In any facility that says, I'm going to fly you there, I'm going to pay for this, I'll pay, I'll do that. When they start doing that, it's a red flag. Yeah. It's a warning. And maybe they'll get away with it with your kid, but somebody's going to get caught in that, and people get hurt. So, when Bob tells you that he can do something or can't do something for you, this is because it's the right way to do things. Right. And you can never, you don't have to doubt that when you're dealing with NB.
And again, just we have an 800 number you can call 24 hours a day, 7 days a week, and somebody's going to answer. And it could be me because I take my turns on the call. And we can answer your questions. And my promise is, if I don't have the answer to your question, I can promise you within 4 or 5 hours I'll have the answer. And that's my commitment to people and my staff's commitment to people.
I hope that this gets some people out there thinking, because I know chances are somewhere in your circle of friends or in your family, there's somebody who needs help from something. This isn't the answer for everybody. Bob has told you that himself. It's not. But don't ignore things. I mean, how often do we see that where they're like, well, I knew there was something wrong, but I wanted to wait and see. Yeah. And we've lost people because of that, right?
Yeah, and people have this, Narcan is a medication that helps people who are addicted to opiates, and what it does is it brings you out of the opiate state. It doesn't remove the opiates from your system, it just brings you out of the opiate states and gets you breathing and talking and everything else. I've had people who have, in the same night, have had to been Narcan 3 or 4 times in one night. Because what happens is that the person all of a sudden says, oh, I feel really good, because now I'm breathing, I'm talking, and I'm up, and I'm mobile, and everything else. What they forget about is that you still have all that heroin in your system. So they feel good, they go out, and they use more heroin. And then they use more heroin. Now they've really overdosed because of that. And I've had people that have been Narcan 4 or 5 times, and then they didn't come out of it then the 5th time, the 4th time, or the 3rd time. And one of the reasons is, there's a dangerous medication, there's a dangerous drug out there now called fentanyl. It's deadly. Fentanyl is absolutely deadly. And, it's a lot of heroin's being cut by fentanyl. People are using fentanyl on its own. It's just so powerful of a drug, it's just unbelievable.
And I know there's people out there scratching their head, you're listening, saying, people wouldn't do that to themselves. Well, they do. Yeah. And it is, we've been in the business, between the two of us, it's probably, 40, 50 years of experience here in the business. There are times when I still scratch my head and think, I don't get it. Yeah. But it strengthens my resolve to keep going, and I'm sure it does for you too. That
I just recently heard of a young man who wound up in an emergency room and he was like totally out of it. And when he finally got him awake and everything, he said, all I did was smoke weed. Well, what he didn't realize was that, and when they did a blood sample and did a urine sample, the weed was laced with fentanyl. So, and so people are doing crazy things,
I know.
Crazy things.
If you can't trust your drug dealer, who can you trust? It's a bad lifestyle. Yeah. And the thing is, we're talking a lot about like these street drugs, and these things are happening at the kitchen table with somebody who's taking their prescription meds the way they shouldn't be taking them, or the guy who's stopping for the cocktail after work and ends up staying 3 or 4 hours. It's not. It affects everybody, and I want to make sure we kind of get away from that it's not all street drugs.
Absolutely.
You help people who become addicted to pain medications or prescriptions.
Yes.
Maybe the stay-at-home mom or the working mom or the dad who just goes overboard, maybe even binging, and they don't drink often, but when they do, they drink too much.
Well, people, one of the drugs that were used in kids and ongoing kids for a long time is called Adderall. Yeah. And it's very easy for people to get addicted to Adderall. And they use more and more and more and more and more and more to maintain that, because Adderall is a stimulant, and we can detox them off of that. But just, people think, well, just because my physician prescribed it to me, it's safe. Well, it may be safe if you're using it for the purpose that it was prescribed for. But if you use more than that, and you increasingly use more and more and more, because I've seen a lot of Adderall addicts with very high doses of Adderall, then you're addicted to it. You're not using it for the purpose that it was designed.
How many times have you come across somebody who, maybe everything was going great in their life, and maybe they were in a car accident, they got some opiates to take care of some pain, and within a short period of time, could be a couple of months or a couple of short years, all of a sudden their life is completely different. How many times have you seen that story?
It was funny. A few years ago, I won't tell you how old I am, but a few years ago I had my hip replaced, and and I wish I'd done it earlier, because now my golf game's a lot better. But
the bionic hip golf game, I love it.
But the reality of it is that it was very easy for me to understand. They had given me Dilaudid, and
wow.
All of a sudden I'm saying to myself, well, now I can really understand this. I can understand how people really like this stuff. So I had it for one day. I said, "Oh, that's enough. I don't want any more of that stuff. Give me some Tylenol or whatever."
Yeah.
But I can understand why people really, because once you start on something like that, you're going to want more and more and more in order to maintain the feeling that you got from the initial time. And after you use it for a while, you got to continue to increase the dosage that you take in order to maintain that. And it's scary. It's very scary.
It's not always a point either, and I think we need to mention this, is that somebody might be looking at someone with an addiction issue or something and saying, they know it's wrong, they just don't care. You know what? When those things happen and you start to use more and start to do that, you do justify it in your mind. You don't really, it's not a matter of right and wrong anymore.
Right.
It's not you're not becoming an evil person.
Right.
You just, the line gets blurred on good judgment, doesn't it?
Well, it does. And, and the thing is, look, there are doctors who do a really great job, and they prescribe medications like that because they're effective in dealing with the pain and dealing with surgery and that kind of stuff, and they're doing it for the very right reason. It's when you as the person, go above and beyond what the doctor prescribes because you're enjoying the feelings that you're getting out of that medication. It's not the doctor's fault. The doctor prescribed to you for a very specific reason. And you want to follow his recommendations because he knows what he's doing. It's when you abuse that. It's when you decide, oh my God, I really like that so much. Can I buy this on the street? Can I buy Dilaudid or morphine on the street? Of course you can buy whatever you want on the street. And that's where it becomes dangerous. And it's not the doctor's fault. You abuse what he had prescribed for you appropriately.
Yes, absolutely. Listen, if you're not sure, if you're concerned that you yourself or somebody you love might be having a problem, just call up, have a conversation. You guys are willing to talk to them.
Always.
If someone says, well, I've used this and they're not sure if they have a problem, you can give them a quick assessment or talk to them or,
Right. Well, and a lot of times when people call our 800 number, they could be calling from, Missouri, let's say.
Yeah.
And they don't necessarily want to come to Florida. And so what we try to do is that we try to hook them up with a treatment facility close to their local home. We'll look and we'll do some research for them to try to hook them up there. There's also a national SAMHSA. You can call SAMHSA. We have a national 800 line. And you call the SAMHSA 800 line and they can tell you treatment facilities within your own home community. But if somebody wants to come from Missouri because they heard we provide good treatment, welcome. Come.
Welcome.
Yeah.
Absolutely. I'm not sure I've ever met somebody from Missouri. Have you? I'm not sure.
No,
I don't know. I think there's people there, though.
Actually, I visited there when I went. It was a beautiful area in the summer. When I was growing up as a kid, we went cross country a couple of times in Missouri.
Well, actually, I have been to St. Louis, so I guess yeah. All right, there you go. Listen, Bob, thanks again.
Yeah.
Great conversation. Again, if you're pregnant, you've had trauma, if you are having a struggle with your addiction, maybe with your medications or something. Listen, information is the start for everything. Right. Call, talk to Bob, talk to his staff, get information, and then make your decision from there. And if you're not sure what's the right thing to do, talk to people. Call us, talk to somebody, but don't keep it to yourself. Absolutely. No matter what you do, if you see something or you feel something's wrong, deal with it. I don't want to tell you about stories where somebody said, I was going to do it tomorrow, and then someone ends up no longer with us. I mean, it happens.
We've seen that happen.
So don't delay. If you need help, ask for help. If you're not sure if you need help, ask for help. It's a phone call, folks. It's all it is.
I always tell people, help is just a phone call away.
It's just a phone call. It's just a phone call. And if you don't like it, you can hang up on Bob, you've been hung up on him before?
Only my wife.
Perfect.
We have.
All right. Bob, thanks for joining us. And you, thanks for joining us. Make sure you stick around and check out our other editions of Insights into Addiction and Mental Health. I'm your host, Scott Jones, Bob Lehmann, and we're with Neuro Psychiatric Addiction Treatment Center. Check us out.